With the news last week that Oregon will not be receiving the expected doses of the COVID-19 vaccine due to supply chain issues, we have one piece of advice. Please be patient. The situation is changing daily. Our topic this week is about the vaccine and if it's right for you. You always have a choice on if you want to get the vaccine or not. Our vaccine program manager, Kim LaCroix, is here to help answer some of our questions. Hi, Kim. As you know, some people are concerned if the vaccine is right for them. Why should they consider it?
Great question, Kimberly. So for me, the number one reason is that I really just want this pandemic to end. I know the vaccine itself isn't going to end the pandemic, but vaccination will. And it's really important that everyone is vaccinated, or as many people as possible are, to achieve community immunity. Vaccination is the safest, most effective, and most reliable way to keep yourself, your family, and your community healthy and safe from COVID-19. And the COVID-19 vaccines are 95% effective, and they've undergone rigorous safety testing.
So as you know, some people are concerned about getting the vaccine. Why should they consider it?
I do understand that some people may be nervous about the COVID vaccine, and I think that's totally reasonable. But fortunately, researchers have been working on vaccines for the coronavirus family for decades, so they didn't have to start from scratch. And then, like any vaccine, COVID-19 vaccines have been carefully evaluated through clinical trials and have met safety standards before being approved by the FDA. And one thing that I think is really important is that the clinical trials for the COVID-19 vaccine, they actually involved more people than a typical vaccine trial, and they involved adults from more diverse populations. So they included many different races, ethnicities, and ages. Another thing that's really reassuring to me is that, even though there was no safety issues that arose during the clinical trials, there is a monitoring system in place through the CDC and other federal partners to monitor the new vaccines for serious side effects, such as that are known as like adverse events. And I think those reasons have given us trust and confidence in vaccination, and it's a great tool in our toolbox to help slow the spread of COVID-19 and help our communities to continue to move forward.
As I said at the beginning, we're asking people to be patient as we don't have enough vaccine right now and we're waiting to get more. So what should people continue to do in the meantime?
Just keep doing what you've been doing all along. Wear those face coverings, keep social distancing, and wash your hands.
Thank you for your help, Kim. And thank you for joining us. Please stay safe and we'll see you next week.